All right, so the machine will be on and it'll come up to this screen. Now sometimes, depending on who used it last, will depend on which probe is already loaded on to use. So currently, you can tell that the linear, which is the probe that you're going to want to use, is currently used, because you can see that it's this square screen right here, straight line across. If it was the curve, it would have a normal, it would look like a curve picture. But either way, you're going to want to change and use the correct settings. So here we have buttons that you're going to use first. So the exam button right here, this is going to change your probe and also load the correct settings for the type of exam that you're going to want to use. So you'll just hit the exam button and this screen will come up. Now we are already, the linear is already loaded, but if the curve was loaded, let me just put this on so you can see, because if it comes up, and you can see the curve right here, so you know that the curve probe is currently loaded. So you're gonna hit the exam button. There's also pictures on top of here that will tell you either the curve or the linear, right? So the little scroll ball in the middle is acting like your scroll bar or mouse. So you'll scroll your arrow over to the linear and you're gonna hit enter, which is right here. Now, unfortunately, it doesn't let us do all of the settings at one time, so you're gonna go back into the exam button for the probe. And here has all of these presets that you can pick for depending on what kind of exam. But for vascular access, right here where it says VAS or vascular, you're going to put your arrow on that, hit enter, and then you have more presets under the vascular. So you can see carotid, the LEV stands for lower extremity vein, LEA is lower extremity artery, but you're gonna wanna come over here to upper extremity vein. And you can use this either for an arm, or if you wanted to do, you could use that same even if you wanted to do an IJ access too. So this will be the best setting for y'all to use. So you'll come over here, put your arrow on there, and again, and hit enter. And these are just preset settings that we've put on here per exam. So this will be the best one for y'all to use. Okay. Now, once you start, we're going to keep doing here, but I'm just going to give you an idea of what to look for and what other options you're going to want to do. So we're going to look for a vein. And there's a couple of things here if you look at the screen. So all of these little dots are veins or arteries. So y'all will go into a vein, and if you see this little arrow right here, see at the very top of the screen, that's going to be the very middle of the probe, okay? And it'll be easier for you guys if you can kind of put that vein right where that little arrow is, okay, whenever you want to go and stick somebody. And you can confirm that it's a vein because as I press, I'm compressing that vein completely, where an artery is not going to compress, right? So that's just one way for you to confirm that that's a vein versus an artery, okay? And just remember that whenever you are holding this probe onto your patient's arm, that you are, you have a very light touch in order to not compress that vein, so you can see it.
And there's the central marker, that line.
Well, actually what you're gonna look for is that. So hold that camera right there. So here's your probe, and these probes have little buttons on them that you won't have to worry about. So when you hold the probe, this side, no buttons, this side is going to be the top of the probe, okay? If you want to turn it, so when you put it on the arm, this side is going to go up towards the head. So you can see the top of the probe is towards the top of my arm. Now, when you want to, which y'all will probably most likely use a transverse view, which will be sideways or across that vein, you're going to turn that probe from straight up and down, counterclockwise or towards you. That's the proper way to go transverse and will make the screen look, make sense, okay? And for those, just for dummy purposes, if you'll look back here, so I am currently sag or straight up and down on the vein, and you can see that dark line at the top. That's a vein, right? So this part of the screen is towards the head of the patient. This part of the screen is towards the feet of the patient, and this is your depth from top of my skin down. If I'm transverse or across that vein, this part of the screen is to the right of the patient. This part of the screen is to the left of the patient. And of course, your depth, top to bottom. Does that make sense? Mm-hmm. Okay. So the next setting that you'll want to just make sure is appropriate for you guys is your focus. So as I was explaining earlier, when the probes produce the sound, there's a focus that the sound waves come down to a point, and that's the focus of the beams. Okay, so kind of, and then they cross, and then they get the information and bounce back, right? This little doodad right here is the focus, the current setting of the probe at the moment. So for you to have the best imaging optimization, you want your focus to be at or right below what you're imaging. Okay, so here is your focus setting, and it's this little toggle switch right here. Now, focus number and focus position. You don't need to worry about focus number. That's going to be more for us for other types of exams. You only want one focus, not two, but one. Okay? So if you push this little button, that will highlight the focus number. You don't want that. So just keep it highlighted on the focus position, and then just turn this knob, and that will change your focus to at or below where your vein is. So this vein is very superficial, so I'm going to keep that. I just moved that focus up to right below where that vein is. Okay, if you have a bigger patient that you're getting through a lot of fat before you can see that vein, you can also use this little switch right here, which it says depth, and you can increase your depth further down into the arm. So if you for somebody who's very large and you're having a hard time, and that vein is 2 or 3 centimeters down, you may want to increase your depth here. Usually at about 3 centimeters, which you see 1, 2, 3, those are centimeters in depth, top to bottom. Okay, so if you do have a bigger person, that's how you would get more depth on the screen. Does that make sense?
Yep.
Okay, so you'll have this toggle for depth, this toggle here for focus. There shouldn't be really anything else on here that I can foresee that you guys would need for any reason. Okay. Now the other thing that you may want to do as far as confirming a vein versus an artery is putting a color box on there. Okay, so you'll just hit the color button and it'll bring up a box here. Now you can move the box on the screen with the little round knob here. Now, if you are, this is just ultrasound, but if you are in a transverse position, meaning you are crossways on that vein, if you'll go back up to the screen and see how that box is at an angle, you want that box, that you want it at an angle if you're in a sag position. But if you're transverse across this vein, you want that box to be a straight rectangle. So you're gonna come over here, and these little toggle switches have changed since we have the color on. And where it says angle steer, you're gonna push the little button to highlight the angle steer, and then you're going to change this to 0 to make that box a regular rectangle. So now if you look at it, you can tell where the arteries are very pulsatile. Like this right here, see how it's very, very pulsatile versus, see how that's pulsatile right there? And then beside it they're just more slower flow in and out. Those are just gonna be more your veins. See how that's just slow kind of in and out? Whereas these arteries are very, very pulsatile. So if you wanna just for confirmation purposes, but the easiest thing for you to confirm a vein versus an artery is just pressing down on that vein to compress. So when you want to go and have access, the easiest way to do it is actually for you guys is to put the probe in your left hand, okay?
Mm-hmm.
Because you'll want to put the needle in with your right hand, correct?
Correct.
Yes.
Unless you're left-handed.
Yes, of course. So what I would do is hold the probe in your left hand, and you're basically going to, if you line up that vein right underneath that yellow triangle, then you can insert the needle right in the middle of this probe, right where that line is. Now when you put a needle in, the needle will be very bright and echogenic and have a little bit of shadowing underneath it, but you'll be able to see it because even though you see the white on the screen right there, it'll be a bright white shiny line that you'll be able to see it come in. Correct.
All the way in.
Yes, and so you'll be able to follow it all the way down. You'll see the vessel kind of bend a little bit as it's about to go through it. But yes, that's the easiest way. You'll see it just come straight down into that vessel. And if you'll just kind of angle your camera back a little bit this way, then that way, but just stay along that line.
And what I like to do is I like to watch the needle come in so I know I'm in the right direction, because sometimes it'll be a little bit off to the right or the left. And once I know I'm on, then I come back and I start looking for the flash on the hub. And then as soon as I see that, then advance the cath. But it's amazing because sometimes you'll see the needle tip actually enter the vein.
Mm-hmm. So then you'll know you're about, like that vessel right there is about 1 centimeter depth. If you look right here, there's your 1. Those are in centimeters. And so at that point, you can change if you want to. Yep. Make it even. There you go. The key is just a light touch, not to compress those vessels, because it's so easy to be like, holding it, trying to keep your probe still, and you're pressing that vessel closed. So just very, very light touch. Angle it back just a little bit so you can see.
She was asking if you're ready for your doctor to doctor. You are?
All right.